Hello, my name is Dr. Paul Scheiwiller. I'm an anesthesiologist at the Institute of Orthopedic Surgery. I'd like to speak to you today before we start your epidural steroid injection and give you some information about the epidural steroid injection. I would like to introduce you to members of the team. The first member, which you have probably already met, is an SBA. An SBA is a special blocking assistant. She has received additional training and is trained to assist me with the block. The SBA will be positioning you and again assisting in the actual procedure. She will be responsible for monitoring you before, during, and after the procedure. Very shortly you'll meet the anesthesiologist. He will be the person that will actually do the procedure. This procedure is very similar to that is done in the hospital for a lady having a baby. However, we're using different medication. It's obviously for a different reason, generally placed in a different place, but the procedure is essentially the same. Many people aren't sure that they're coming to see an anesthesiologist, or if they know they're seeing an anesthesiologist, they're not really sure why. The reason is because anesthesiologists are trained to place medications in the back around the nerves that go down to the legs. Your anesthesiologist is not a pain or a back specialist. We will be using medications today that are called steroids. Steroids are anti-inflammatory medicines, and that's all that these steroids do is decrease inflammation irritation. They won't move your bones around, they don't open up spaces, they won't pull disc material back, they don't do anything mechanical. What they do a terrific job at doing is helping to control inflammation irritation of the nerves that go down generally to your legs. Generally speaking, epidural steroid injections are not specifically for low back pain. However, on occasions they can be very helpful. If you have very significant inflammation irritation, you may get very significant relief. This relief will generally last until the inflammation irritation returns. This could be measured in weeks or many times months. However, if your symptoms are from pinching, squeezing, or from some other place, for example, your hip, leg, or knee, or from another part of your back, which could be muscles, ligaments, or joints, your relief may not be so good. Your pain relief may be very little, may be very short term, or it's possible you may receive no pain relief at all. We'll find out because we'll place your steroid medication today. Your medicine will go in today. It will take at least 3 days before you will notice any significant improvement. It can take up to as long as a week. If you have no relief in a 1-week period, please call us. We will schedule you for one more injection at approximately a 2-week interval. We say 2 weeks because it takes approximately 2 weeks for this medicine to work its way out of your system. So we don't do it any earlier than that. If you have no relief from the 2 injections, we send you back to the referring physician. In this instance, these injections are considered failed. A different plan may be indicated. However, hopefully, you'll get significant relief. We define significant relief generally as 70% or greater. This is defined on a case-by-case basis, as some people might feel that 50% relief is very significant, whereas some people may get 70% relief and feel as if they are not getting enough relief, for example, still having trouble sleeping or going to work. Significant relief is defined by you, the patient. We don't do another injection until the inflammation and irritation returns. You know your inflammation and irritation is returned because your symptoms return. This indicates the start of the process of inflammation irritation returning. Call us when your symptoms are starting to return. Don't wait till they are very severe. Generally speaking, the earlier the better the effect. Many times these steroid injections have a longer duration clinically. They seem to have a more rapid onset, and many times they even work a little bit better, giving you higher quality. Generally do 3 epidural steroid injections in a 12-month period. If you use up all your injections and your pain returns, we refer you back to your referring physician. The steroid therapy has to give you 2 things. It has to give you quality of relief, and it has to give you significant duration. If it doesn't do both, reevaluation is indicated. The procedure is basically designed with your comfort and safety in mind. To date, we have done greater than 7,000 procedures here at the Institute of Orthopedic Surgery. You will be asked to be in the seated position, and you will be placed into a padded positioner for your comfort. The area will be prepped and draped. An ultrasound probe will be placed on your back. The ultrasound machine allows us to see through your skin and look at the bones and determine the level to be injected. We then numb up your skin with a tiny numbing needle. A special block needle is placed through the numb skin and is directed to the proper location. Medication is then injected. Usually this takes several minutes, sometimes as long as 10 minutes. Once the procedure has been completed, we remove the needle and you're done. Anytime we put a needle in anybody for any reason at all, there is a small amount of risk. Risks include headache, backache, bruise, or infection. These are not common things, but they're not particularly rare. Damage to your spine or spinal cord is very rare. To date, we've not seen any of these risks or these at the Institute of Orthopedic Surgery. The medication we use is very strong. Medication may increase your blood sugar if you're diabetic. It may lead to retention of fluid in the feet or ankles, which would generally last 2 weeks. Again, we will monitor you both during and after the procedure. A few housekeeping tips. Before we get started, your guests will be asked to exit. We will bring in our equipment. You will be hooked up to monitors, which include EKG, finger clip, and blood pressure cuff. We understand if you're nervous, but please don't worry. We're going to take great care of you. When I return to see you personally, there'll be plenty of time to answer any questions that you may have, and please don't hesitate. I look forward to meeting you and visiting with you. Thank you very much.